Talk with the GO MRI man. Spread the knowledge. Motivate the people.
Have any questions? That moment of the diagnosis, just because I think it's important, right? So for X-ray, it's definitely out of our scope to diagnose, right? And a lot of people assume we just push buttons. So we can't diagnose, but we could definitely look at their image, and we call it image acquisition. Look at the image and try to look for pathology, right? Like we have the patient in front of us, we can ask them questions, and we can kind of like pass that information over to the radiologist. And so no, we're not diagnosing, but what we should do as technologists is take a look at the image that we created and the information we got, and then pass that over to the doctor. That right there is something within our scope. What we can't do is tell the patient. We cannot say, "Hey, look, there's a fracture," or "There's no fracture," because we could be wrong. We're not the doctors. That is out of our scope. So when it comes to being a technologist, there's different skills, because you could be someone who just takes the image, or you could be somebody who actually helps the doctor by providing that additional information. So I highly recommend try to get that, like build on that scope. It literally only takes a minute or two to look at your images. And then what I would recommend if you're an X-ray tech or thinking about it, is once the report does come in and you kind of had an initial diagnosis, check the report and see if it matches up. And then that's how you'll know if you're in the ballpark. Like I suspected it was pneumonia on that chest X-ray. Let's see what the doctor says on the official report. And then if you see pneumonia, well, there you go. Now you know what pneumonia looks like on an X-ray, and that way you can recognize it on the next one. So that way, let's say you get a patient, you take the chest X-ray and it's pneumonia. Maybe you could pass the report over as a stat. Like, hey, look, pneumonia. I think this patient, needs to get looked at right away. So again, you're not diagnosing to the patient, but you're definitely still assisting and staying within your scope over here. So I got to give a lot of credit to sonographers, because there's more pressure with diagnosing. So the fact that I don't have to like legally diagnose it is kind of like an ease off my shoulders, right? Because I could leave it to the doctor. So the fact that the sonographers in ultrasound has that responsibility, I give you all a lot of like kudos, because you're doing your job, you're working with the patients, and you have that. So I think that's one of the challenges that they deal with, that we don't have to as much, but we could still add that to our skill. I don't know if that